Hi, I'm Dr. Michael Kohler, and the purpose of this training video is to show students all of the steps of the physical examination from start to finish so that you get some idea of how the steps flow one to the other and how to make a transition from one body system to another. We're not going to focus on the details of the steps during this examination or any close-ups, and if you feel like you need some reference to the details, I'd refer you back to the individual exam series for those details. This examination, of course, is on a male patient, so there'll be no axillary lymph nodes or no breast examination, and also we will not do a genital examination on this video. And I'd like to thank John, one of our standardized patients, for agreeing to be part of this training video. The steps, of course, can be in a different order. It's not critical that every one of the steps follow the order that you see in your outlines from class. But what is important is that all the steps are done. You do want to make sure that if you rearrange a step, that you try to minimize patient movement up and down and pay attention to patient comfort if you arrange the steps so that there is a flow for the patient and there's no unnecessary movement. And of course, before we begin any examination, we always wash our hands. So first I'm going to wash my hands. The first step of the examination would be to describe the patient's general appearance. And of course, you're not going to describe that to the patient, but throughout the history, you're going to be noting whether the patient looks at their apparent age, whether they're in any apparent pain or distress, and also whether their respiratory pattern is labored or is there any sign of distress. And John certainly appears his stated age. He doesn't appear to be in any discomfort. His hygiene is good, and there's no obvious signs of pain. So I'll just go ahead and move on. So the first thing I'm going to do is ask you to hold out your hands for me, John. I'm just going to take a look at your hands and your fingers here. Is there any pain or discomfort
No.
as I do that? How about these joints or knuckles or any pain?
No.
Then put your palms up. Okay, good. And put your wrists back down again. Any pain when I press on your wrist bones here?
No.
No? Good. And I'm just going to feel along your forearms there. Okay. I'm going to feel different parts of your elbow. Is there any pain or discomfort as I press on those bony prominences? No? I'm just going to press a little bit higher. There's sometimes some lymph nodes higher up in the arm, but again, I don't feel that. So you can rest your arms down. The next thing I want to do is to check some range of motion and muscle tone. So I'm going to ask you to kind of let your arm go loose and kind of floppy here. And move it back and forth. Good. Kind of bend your elbow back and forth. Then your wrist up and down. In and out, good. I come around the other side and do that over here too. Again, just kind of back and forth. Just relax your arm, good. Your wrist back and forth, good. Okay. Now I want to have you check for you doing the range of motion. Can you hold your wrists up, cock them up, then down, good. Then put your wrists in, then out, good. Spread your fingers out and back in, make a fist, and make muscles and go straight out. Good. Now I want to test the strength in your upper extremities. So could you put your arms up like that, hold them real strong, don't let me push down. Good. And make muscles like that, pull in towards you, real strong, good. And push out against me. Good. Next I'm going to have you hold your wrists up. I'm sorry, good. And then don't let me push them down, real strong, good. Now push down to my hands, okay. Push down, good. Actually grab my fingers, squeeze real hard. Good, okay. The other thing I want to do is have your elbows at your side and check your wrists to go up and down. Good. Okay. All right, good. So that's pretty good for the upper extremities. Now I want to check the pulses in your wrists. So just kind of relax your arms. I'm going to count your pulse here by looking at my watch. Good, and your pulse is nice and regular, and I get it to be about 78, so that's normal. The next step I want to do, John, is to check your blood pressure. You want to make sure the cup is the right size. Just kind of lift this up a little bit. I'm just going to actually put your arm to the side. Good. I also want to check. Good. Okay, so this is the right size cuff. If we use the wrong size cuff, it'll falsely elevate your blood pressure. Just so I can get a rough idea of what your blood pressure is, I want to, I'm not going to use my stethoscope at first. I'm just going to pump up the cuff and get some idea when your pulse goes away so I know what the top number is here. Good, and I get it to be about 138, which is a little bit on the higher side. As we talked about in the history about your high blood pressure, we'll talk about that further after the examination is over with. Next, I'm going to go ahead and check your blood pressure. Ask you just kind of let your arm stay loose and let me hold it up. Keep your elbow nice and straight there. Okay, good. I get 130/86. Now I'm going to check it in the other arm here. I can kind of bring this around the back. Good. I get 132/84. So there's always a little bit of difference between the arms, but that's an acceptable difference. Good. Next I want to just kind of examine your head. And you turn your head to the side there for me. The other way, good. And I'm just going to touch different parts of your head and scalp. You tell me, is there any pain or discomfort as I do that?
No.
Good. You can turn your head this way. Just want to look a little closer look at your scalp here. See if there's any. And lunge your head forward. Good. And that way. Just checking to see if there's any scalp skin problems. And I don't see that. Good. Then I'm going to have you just look up towards the ceiling. I'm going to pull your eyelids down here. Good. Okay. And that looks fine. I'm going to check your vision, John. I'm going to have you, what I'm going to do is have you put one palm over your eye and hold this card in your other hand. And why don't you try to read that line for me there?
All right. It's 374258.
Good. Can you try the line below that?
937826.
Good. How about the line below that still?
428739.
Good. So you got all those answers right. So that's 20/20. Let's have you do it in the other hand, palm over the other eye. Good.
Good for this
Try
one.
this line right there, yes.
937826.
Good. And the next line below it. Can't do that one?
426. I'm kind of good from memory.
Oh, then don't do it. So that'd be 20/25 in your left eye. Good. Okay. Next, I want to check what we call your peripheral vision. So I'm going to ask you to do, John, I'm going to ask you to stare right at my nose. I'm going to wiggle my fingers to one side or the other or both. I'm going to ask you just to point where you see that wiggle. So you can try just to stare at me and I stare at you and tell me which side you see wiggle. Okay?
That side.
Okay.
That side.
Good.
Both sides.
Good. Okay, I'm just going to move here now.
That side.
Good.
That side.
Good. And then now.
Both sides.
Good.
That side. That side.
Good. That's good. Your peripheral vision is fine. I'm going to check your pupil response to light. So I'm going to ask you, John, just to kind of stare straight across at the wall. Okay? Let's just shine the light at your eyes and see how your pupils constrict. Good. Good. And both pupils are working normally. The next thing I want to do is check how well your muscles in the eye move the eyes around. So I'm asking you just to look at my finger and just to keep your head straight. And just move your eyes to look over here. Good. Then look up. Look down. Look all the way across. Up. Down. Good. And then I'm going to have you look in. Good. That's all fine. Next part of the examination I want to do is to check the sensation on your face. And what I'm going to do, John, is just touch different parts of your face with this cotton tip. Maybe you close your eyes, and when I touch, just tell me where I'm touching, okay?
Forehead.
Okay.
Forehead. Cheek. Cheek. Cheek.
Good.
Chin. Chin.
Good. Okay. You can go ahead and open your eyes. That was all fine. Then I'm next going to have you do next is to wrinkle your forehead. Just kind of look up at the ceiling. Good. And show me your teeth real wide. Good. Okay. I want to check your hearing now, so I'm going to rub my fingers one side or the other. And if you close your eyes and point to me which side you hear the rub on. Okay?
That side. That side. Both sides.
Good. Okay. And can you turn your head to the left and just give me a cough? Good. Okay. You can look straight ahead now. I'm going to have you shrug your shoulders, so just lift up. Good. And turn your head that way against my hand. Good. Now push the other way. Good. Okay. And then stick your tongue out at me. Good. Okay. Most patients usually like that part of the examination. The next thing I want to do is start to examine some of the neck and shoulders. So you know what? Let's have you, if you can lower your gown in front here. Okay. First of all, can you touch your chin to your chest? Good. Then go straight back. Good. Then touch your chin to your shoulder. Good. Then your chin the other way. Good. And next I want you to kind of tilt your head towards one shoulder and then the other side. Good. Okay. And just want to examine different parts of your shoulder here too. Good. Okay. You can take your arms and just go straight out and over your head. Okay. Now put your hands behind your head. Good. Then I want you to kind of touch back behind your. I just want to see how far up you can get your thumbs. Good. Okay, that's normal. You can go ahead and put your arms back in your gown. Now I'm going to go back up to the eyes. I want to do a little bit more complete examination of the eyes by looking at the fundus or the back of the eyes. What I want to do is I'm going to turn off one of the lights in the room to darken the room just a little bit. I'm going to have you stare straight across at the wall there. I'm going to come rather close to your eyes, and when I do that, I'm going to ask you to try not to look at the light or look at me. Just try to ignore me. Okay?
Right.
Good. Okay, I'm going to do the same thing in the other eye. Let's come over to the other side here. Again, just stare straight across at the wall. Good. And those blood vessels in the back of the eye all look normal. Next thing I want to do is to look at your ears. So first I'm just going to look at the top of the ears here. Okay, and I'm going to look inside the ear at the eardrum. Okay, and that looks completely normal. There's no wax or any sign of infection. The same thing here. I'm going to look at, just pull your ear back and take a good look at that. Good. Both your eardrums look completely normal. And the next thing I want to do is to look at your nose. I'll try not to touch the middle or the septum of the nose. That's real sensitive. But just kind of look straight across the room. Okay. And the same thing here. Good. That all looks normal. The next step I want to do is to look into your mouth. I'm going to use a tongue blade for that. So can you open your mouth? I'm going to look at your gums and your teeth. That looks fine. You touch your tongue to this side. Good. Now the other side. Good. Now curl your tongue up, touch the roof of your mouth, and put your head down just a bit. Good. Okay, now stick your tongue out. Say ah. Good. And that all looks normal. Next thing I want to do is to examine for various lymph nodes and salivary glands in the head and neck. And I'm going to stand behind you to examine those areas. Okay, so just kind of keep your head straight. Checking the parotid glands. Can you punch your shoulders up just a little bit? Okay. I'm just going to under your chin here. Good. I'm just going to feel for the glands in the very back of the head here too. Good. And there doesn't seem to be any swollen glands at all. Next thing I want to do is just feel for your windpipe or your trachea, that it's in the middle here. And it is, and it moves freely. Good. Next up I want to do is to feel for your thyroid gland. And that's a little butterfly-shaped gland that sits in the bottom of the neck. And to help me examine that, I'm going to ask you to take a sip of water and hold it in your mouth. And when I tell you to, once I get my fingers in position, I'll have you swallow for me. Can you go ahead and swallow? Good. Can you take one more sip? I'm going to move my hands a little bit different position. Go ahead, swallow again. Good. Okay, that all feels normal. The thyroid does not feel enlarged or doesn't appear to be any nodules on it at all. The next thing I'm going to do is to go ahead and start to look at your back and your lungs. First, I'm just going to take a good look. Your spine seems to be nice and straight. There's no curvature to it. I'm going to sort of just pound on your spine with my fist. Does this hurt at all?
No.
No discomfort?
No.
Okay, I'm also going to pound a little off to the sides. Does that hurt there?
No.
How about here? Is that sore?
No.
Good. Okay. The other thing I want to do is to just watch you take a couple breaths in and out. So, and another one. Good, and everything seems to move symmetrically. I'm just going to put my hands around the bottom of your chest here now. Just breathe in and out again. Just breathe normally. Again. Good, and there seems to be a nice normal symmetric movement of both sides of the chest. What I want to do now is I'm going to put my hands on the back of your chest, and every time I move them, I'm going to ask you to say the word 99 for me. Okay?
99, 99, 99, 99.
Good, and that's all normal. If I could have you now grab your each shoulder like that. That kind of moves your scapula off to the side. You can actually let your arms rest, but just that kind of moves your scapula off to the side. I'm going to percuss on your lungs here, so it can be some tapping. Whoops. You know, actually, can we pull this down in front here too? Mm-hmm. Okay. Make it a little bit easier. Good. I'm just going to percuss in front. You can put your arms at your sides. Good. Great. Okay. Now I'm going to listen to your lungs with my stethoscopes. I'm going to have you grab your shoulders. Just breathe in and out through your mouth for me. I'm going to come around, listen in front. You can relax your your arms. Good. And your lungs sound completely normal. The next part of the exam, I'm going to be focusing on the cardiovascular system. So what I'm going to ask you to do is if you can I'm going to lift the head of the table up just about 30 degrees here. You could lay flat for me and pull the ledge out for your feet. You can just do like that, that'd be fine. I also need to get one other straight edge here, so let me just grab something from the desk. If you could turn your head just to the left just a little bit, John. I'm looking at the neck veins, which are a sign of your hydration or your volume status. I'm looking for a pulsation. I'm going to put one of the rulers here on your chest. I'm going to put the other ruler to where I see the pulsation. And actually, good, the actual pulsation would make a line under 0, which is normal, so your volume status would be normal. So I'm just going to put this down. Could you just sit up just a moment? I'm going to put the table all the way flat now. Good. And go ahead and lay flat. Next I want to do is to palpate the pulses in your neck, the carotid arteries. Good. And over here. I'm going to also put my finger in what we call the suprasternal notch that allows me to see if there's any abnormal pulsation from your aorta. And that's normal too. Just want to look at your chest wall here too. It all appears normal. I'm going to put my hand on different parts of your chest, John, just to see if there's any abnormal contractions from your heart or from any of the chambers of the heart if they're pumping too vigorously. Good. Okay. Now I'm going to take out my stethoscope and I'm going to listen to both the arteries in the neck and to the heart. Okay, so just breathe normally here. Okay. And now I'm going to listen just to your heart. Good. That all sounds normal. I don't hear any murmurs or abnormal sounds. So the next part of the examination we're going to do is for the abdomen. So you put your arms back through the gown. If you can kind of lift up your gown for me to expose your abdomen there, John. Just a little bit higher there. Good. And put your arms at your sides. Okay. The first thing I want to do is take a listen to the bowel sounds in the abdomen. Good. That all sounds fine. Next thing I'm going to do is just to examine your abdomen by touching lightly on the different parts of your abdomen here. You let me know if there's any pain or discomfort.
All right.
Is there any pain?
No.
No? Down low here?
No.
Here? Okay. Now I'm going to press a little bit deeper, and this will be maybe a little bit uncomfortable, but it shouldn't be painful. Again, let me know if there's any pain or discomfort. Good. None of that hurt?
No. I would assume normal.
Just normal pressure. Okay, good. Next thing I want to do is I want to feel for your liver edge. So I'm going to put one hand behind your ribs here. And you take a deep breath for me. Exhale. And I didn't feel it, so I'm going to move my hand a little closer. Ask you to do that again. Okay. And then one more time, deep breath. Good. Okay, and I did not feel the liver edge, which is not unusual. Next, I want to tap on your chest and abdomen and see if I can get a rough estimate of the size of the liver edge here, too. Okay, I'm going to start from above here, too. Okay. And their liver span seems to be normal, does not appear to be enlarged. So that's good. The next thing I want to do is to feel for your spleen tip. I'm going to reach across and put my arm behind your ribs here. And ask you to take a deep breath for me. Good. Exhale. Another deep breath. Exhale. And one more. Good. And I don't feel your spleen tip, and that's normal. So that's good. Now I want to feel for your kidneys. So I'm going to put my hand behind your back here. I'm going to kind of press somewhat firmly and ask you to take a deep breath. And exhale. And one more time. Good. And I don't feel your kidney on that side. Do the same thing over here. Again. Good. And I don't feel your kidneys, and that's normal. We usually don't feel them in adults. The next thing I want to do is to ask you to turn onto your right side here. I'm going to see if, one more other position if I can feel for your spleen tip. Good. So I'm going to put my hand behind your ribs. Ask you to take a deep breath. Exhale. Another deep breath. Exhale. And one more deep breath. Good. And I don't feel your spleen tip, so go ahead and lay flat. Next thing I want to do is to feel for the pulses in your groin and also for the lymph nodes in the groin. So let me just move the gown a little bit here. Okay. Just going to palpate first of all for the pulse here in the groin, the femoral pulse. Good, and that's normal. Now I'm just going to listen to the blood flow in that pulse here too. Okay. Good. It's a normal sound. Just want to feel in this area too if there's any swollen glands in the groin. Okay. And there are none. I'm going to go to the other side here and feel for the pulse here too. Good. That's a normal pulse. Let me just put my stethoscope over that area too to listen. Good. That's normal blood flow. I don't hear any signs of blockage. And just like the other side, I want to feel for any swollen lymph nodes in this area too. Good. And I don't feel any swollen lymph nodes in the groin and the inguinal area, and the pulses are normal down in the groin too. The next part of the examination I want to do involves the feet and the legs. So I'm going to first move down towards your feet here and check for the pulses. There's actually two different places I'm going to check. One's on the top of the feet, there's a pulse. Good, nice and strong. And then behind the ankles, there's also a pulse. Good, and those are normal. Next, I'm going to press somewhat firmly against your shin. I don't mean to hurt you, but I'm just checking to see if there's any signs of fluid retention, and also on the top of your feet. Good, and there's no fluid retention. Now I want to check some of the range of motion of your legs. I'm just going to gather the sheet there between your legs there. And just have you bend your ankle back and forth, and invert it, and invert it. Good, now I'm going to bend your knee here, and then rotate it. Good, do the same thing with the other foot here. Have you lift up, down, out, in, bend your knee, and then bend at the hip here, rotate in, rotate out. Good. Now I want to test some of the strength in the various joints here and muscles. Can you push down on my feet like you're stepping on the gas? Good. Lift your toes up towards you. Hold them there real strong. Good. Okay. You bend your knee here. Pull your leg in towards you. Resist me. Good. Now push out against me. Good. And the same thing here. Push out against me. Good. Now pull in. Good. Have you lift up your leg here. Don't let me push it down. Hold it up real strong. Good. Put it down. And then the other leg here, let's do that here too. Lift up. Hold it real strong. Good. Nice strong pulse. Good. So our muscle strength. So again, all the strength in the muscles is normal there too. Next thing I want to do is to check for sensation in your arms and legs. We're going to do 4 different tests. Let me just go grab something from the countertop here. What I'm going to do is just, you can open your eyes for just 1 second, John. I've got a little piece of cotton here. And I'm going to start off by touching either your right or your left foot or leg. And you tell me, you close your eyes and tell me where you feel me touch, okay?
Oh, okay. Left. Right. Right. Left. Left. Right.
Good. And I'm going to just run the cotton up your leg. Does that feel the same as we go from foot towards?
Yes.
Okay, and the same thing on the other side. Does that feel equal?
Yes.
Good. Okay, now we'll do the same thing on your hands. You just have put your arms there. You can just say which side you feel me touch you with the cotton.
Right.
Good.
Left. Left. Right. Right. Left.
Good, and that's all normal. You can open your eyes. Now I'm going to do, I just broke this little swab in half, and this has a sharp sensation, you can tell. I'm just going to start with your feet and tell me which side you feel me touch you, okay?
All right. 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 Left. 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 Right. Right.
Good. The same thing now would do your hands. You're going to put your palms up. Let's try that here.
Right. Left. Left.
Okay, palms down.
Left. 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 Right. Right. Right.
Good. So that's all normal. You can open up your eyes. Next thing I want to do is check for your sense of position. I'm just going to grab your finger here, John. I'm either going to lift your finger up or down, and I want you to tell me which way you feel it move, okay?
Okay.
Close your eyes.
Down. Down. Up. Up.
Good. The same thing in the other hand here.
Down. Down. Up. Up.
Good. Now I'm going to do the same thing in your big toe on both sides. Again, this will be up, and that'll be down, okay?
Up. Up. Down. Down.
Good. And the other foot here.
Down. Down. Up. Down.
Good. Okay. Open your eyes. Next thing I'm going to do is this is a tuning fork and it has a vibration sense to it. I'm going to put it on your knuckles. And I want you to tell me if you feel the vibration and then also tell me when you feel it go away. You feel that?
Yes.
Okay, tell me when it goes away.
Now.
Good. Same thing over here. You feel that?
Yes.
Okay, then tell me when it goes away. Is it gone?
Yeah, because
Okay.
the pressure on there.
Well, let's try it again. If you're not sure, maybe I moved off the knuckle. Can you feel that?
Yes.
And tell me when it goes away.
Yes.
Okay, good. All right, now we're going to do it on the ankle too. Do you feel that vibration?
Yes.
Okay. Now tell me when it goes away.
Yeah, it went away.
Okay. And the same thing over here. You feel that?
Yes.
Tell me when it goes away.
Went away.
Good. Okay. I'm going to tickle the bottom of your toes here now. It might seem a little uncomfortable, but again, that's not my purpose to make it uncomfortable.
Okay.
Good. Okay. And the same thing over here.
Uh-huh.
Good. Okay. Next, I want to just check something else here in your ankle. I'm just going to kind of move your foot forward. Good, and same thing over here. Good, okay. I'm going to pull this ledge out a little bit. I'm going to check your reflexes now. So I'm going to start off with your knees here. Just let me kind of lift it off. Okay. Okay. Just kind of bend your knee just a little bit, like that. Okay. Come around. Bend it just a little bit. Good. Okay. I'm going to check your reflexes in your arms here too. Just like that. I'm going to check your biceps. Okay. Your biceps over here. Okay. And then you can check your triceps reflex. You can put your arm, just let it relax and lay limp. Okay. Same thing here. Just kind of let your arm hang limp. Good. Okay. And that takes care of the reflexes. Now I want to check some coordination maneuvers. So I'm going to have you touch my finger to your take your index finger and touch my finger, and touch your nose. Touch my finger, your nose. Touch my finger, your nose. Good. Now use the other hand. Same thing. Touch my finger, your nose. Your nose. Touch your nose. Touch my finger, and touch your nose. Good. I'm going to have you just real quickly tap your fingers back as fast as you can. Great. Okay. Then I want to do is to have you put your heel here on top of your knee and just kind of slide it down your shin in a nice smooth movement. Great. Now do the other side for me too. Slide it straight down your shin. Good. Okay. Why don't you go ahead and sit up. Let me just take this sheet out from your legs. You can go ahead and stand up over there for me. Let me tie the gown up for you here and back. So the next thing I want to do is I want to check some movement with your back, as well as check some other walking. So what I have you do, John, lean forward and touch your toes. Okay, then straight up. Now can you kind of arch your back and go backwards? Good. Okay. Now with your arms at your side, I just want you to kind of go to the one side and the other side. Good. And that's all normal. Let me tie up your gown a little bit better here. I'm going to have you walk across the room now. You go ahead and walk to the wall, then turn around. Just walk normally towards this wall. Good. Okay, turn around. I'm going to have you put, like you're walking a tightrope, one foot in front of the other, heel to shin. Okay, turn around and do that again for me. Good, and then turn around. Next thing I want to do is I'm going to check another test for balance. You can put your 2 feet, that's okay, that's okay. Put your 2 feet together and head up and close your eyes and just try to stand still there. And just kind of check your balance. Good. You can go ahead and have a seat back on the table. Let me just wash my hands again now that the examination is complete. So aside from being a bit overweight, John, your examination is normal. Your eyes, ears, nose, throat were all fine. Your blood pressure was at the upper edge of normal, but it was still acceptable. Your heart was beating regular, no murmurs. Your lungs were clear. None of the organs in the abdomen were swollen or enlarged. Your pulses were good in your groin, down to your feet and your wrists. And all your strength and the neurologic tests we did all seem normal too. So thank you for participating in this training video. We hope you find this video helpful, and again, in the flow of the steps. You certainly could do it a little bit faster than I was. I was purposely moving slowly for the purposes of camera angles and for good video technique, and certainly you could speed things up a little bit more than I was doing. Again, we hope you find this tape helpful, and of course the only way you'll get good at doing a complete examination is by practice. Thank you.